Good morning, my name is Stephanie Hoganson and I'm the Research and Policy Director at Children's Defense Fund, Minnesota. As the Minnesota Kids Count grantee of the Annie Casey Foundation, we work with the foundation to release their annual National Kids Count Data Book and state rankings on child well-being. This year's National Data Book, released today, ranked Minnesota #1 in child well-being among all 50 states. Minnesota's history of investing in children and families has been reflected in the foundation's child well-being rankings for the 26 years that the data book has been published. All but once since 1990, we have been in the top 10 states. Minnesota often ranks high on these types of quality of life lists, and Minnesotans love to boast about how great our state is. But we cannot let pride to overlook the finer points of what Minnesota's data on child well-being tells us. For some children in our state, particularly those who are from lower income families and children of color and American Indian children, societal barriers, including structural racism, under-resourced schools, and lack of economic mobility, result in chronic inequities in our state that are often some of the worst in the country. We cannot be content with a high ranking that masks these chronic disparities, particularly in education and economic outcomes for children of color in our state. While it's morally imperative to address these disparities, our changing demographics demonstrate an economic imperative as well. The success of our future workforce and economy depend on the success of all Minnesota children, an increasingly diverse population. The number of children in Minnesota remains stagnant over the last few years, but the face of those children is changing. More than 30% of our children under age 5 are children of color in this state. For these children to be successful, we need to rethink all of our systems that serve children and families and address systemic racism and inequalities to ensure that children can access opportunities that are culturally relevant and support family success at the point before children get sick, drop out of school, get into trouble, or suffer family breakdown. To analyze exactly where we're at in Minnesota and what still needs to be done, let's take a closer look at the data in the National Kids Count Data Book. The data book examines overall child well-being and bases its state rankings on 16 indicators across 4 categories: economic well-being, education, health, and family and community. Improvements in economic well-being and health indicators really propelled the #1 ranking up from 5th last year. In the economic well-being category, which we ranked 5th, we saw decreases from 2012 to 2013 in child poverty that were slight. However, as the report addresses, when compared to the start of the recession, low-income families still have a long way to recover. More than 40,000 more children are living in poverty in 2013 compared to 2008. As median income continues to decline and the median wage of available jobs is lower than at the start of the recession, it's evident that it's taking longer for lower-income families to recover. 1/3 of all Minnesota children live in low-income families, defined as twice the federal poverty guidelines, or $47,000 a year for a family of 4. It's a closer estimate to a family's basic need budget than the poverty guideline. Black and American Indian children are 3 times as likely as white children to live in low-income families, and Asian and Hispanic or Latino children are more than twice as likely. Contributing to the disparity in income, Minnesota has one of the worst disparities in unemployment in the country. Family income affects all aspects of child well-being, particularly education and health outcomes. The health category saw decreases in the rate of child and teen deaths and teens who abuse alcohol and drugs, which moved our rank from 17th last year all the way down to 2nd. Child and teen death rates have been declining, with the exception of a few bumps, for more than 2 decades, due to increased access to health care, reduction in death due to accidents, from increased safety factors like car seat improvements and increased seatbelt use. Teens abusing drugs and alcohol has also been on the national decline. The data book notes that Asian and African American children are the least likely to abuse drugs and alcohol. While the rate of low birth weight babies declines, we have significant disparities in this outcome for Black and Asian babies in Minnesota, who are more than twice as likely to be born at a low birth rate, which increases the risk of infant mortality and developmental delay. Access to health insurance and health care has always been a priority in Minnesota, but we must continue to invest in programs and policies that improve access and not move backward, as we did this legislative session with a $65 million cut to Minnesota Care. We asked low-income working Minnesotans on the program to pay more for their health care and we need to increase access and affordability, not move backward. A quick overview of the education indicators show a pathway to success. If a child attends preschool, he or she is more likely to be ready for kindergarten, more likely to meet reading and math standards on time, and that leads to increased likelihood of graduation. Even though we rank 6th in the education category, fewer than half of our 3- and 4-year-olds attend preschool. Nearly 60% of our 4th graders are not proficient in reading, and more than half of our 8th graders are not meeting math standards on time. It's evident that there's lots left to be desired in our education system. Recent investments made this legislative session to increase availability of preschool through early learning, scholarships, Head Start, and school readiness programs showed our continuing commitment to expanding access to preschool, particularly to children of color and low-income children, who are least likely to go to preschool and receive the most benefit when they do attend. However, the investment was nowhere near enough to ensure all children can reap the long-term benefits of high-quality early childhood education programs. With the aging workforce, ensuring all children are ready for school, meet academic standards on time, and leave school prepared for college and career is more vital than ever. Lastly, under the family and community category, Minnesota ranked 4th among states. In all 4 indicators in this category, Minnesota has better rates than the national average, with some of the lowest rates in the country of children living in single-parent homes, teen birth rates, child living in high-poverty neighborhoods, and families where the household head lacks a high school diploma. However, the rates of children in single-parent homes, parents without a high school diploma, and children living in high-poverty neighborhoods is on the rise. Particularly concerning are the increasing rates of children living in high-poverty neighborhoods, where more than 30% of the population live in poverty. 76,000 Minnesota children live in these neighborhoods, and Black, American Indian, and Asian children live in these neighborhoods at 10 times the rate of white children, and Hispanic children live in the neighborhoods at 5 times the rate. Newer research continues to show the negative impact on children that live in these areas, which are often deprived of resources and have poorer performing schools, fewer parks, less access to healthy foods, healthcare providers, and also have higher crime rates. The negative impact affects all children in the neighborhood, even if their families have higher incomes. Addressing concentrated poverty through creating affordable housing in all neighborhoods and holistic partnerships to support families, such as the St. Paul Promise neighborhood and the Northside Achievement Zone, are worthy efforts to fund and replicate because they are improving outcomes for children and families, particularly children of color living in these high poverty areas. Ultimately, what the report and our #1 rank show is that Minnesota really does know what works to ensure positive outcomes for our children, and that when we invest in children, it creates a more prosperous economy and thriving quality of life for all of us. However, not all children in the state have access to the effective programs that support their success, and particularly children of color, American Indian children, and children from low-income families. With children of color rapidly growing in the state, the call to eliminate disparities and invest in culturally relevant and evidence-based programs that support family and child success must be louder now than it was ever before. The Kids Count report specifically calls for 2-generation approaches to improving family and child well-being while addressing disparities by providing parents with multiple pathways to get family-supporting jobs and achieve financial stability, ensuring access to high-quality early education, and evidence-based elementary school programs that improve academic outcomes, equipping parents to better support their children socially and emotionally and to advocate for their kids' education. Thanks to Governor Dayton and state legislators, recent investments in early childhood education programs, the Child Care Assistance Program, and increased investments in our schools and Indian education, as well as an increase to the minimum wage, demonstrate ways Minnesota continues to be committed to children. Moving forward, we must build upon these commitments and fully fund the Child Care Assistance Program, improve access to home visiting and parent mentorship programs, and support evidence-based programs like Freedom Schools and the Reading Corps that improve education outcomes for children. Supporting children and families with a focus on addressing disparities will pay off in the future through an increasingly prosperous economy and well-educated and productive workforce, as well as keep Minnesota as one of the best states for children and families.